One of the most precious resources in our country is our senior citizen population. Unfortunately, we're not doing enough for them by providing enough community resources or protecting their health care. There are things to consider when talking about protecting their health care, like the cost of health care, medications, and their impact on their health care, and the community resources and what we can do to improve availability to both patient and medical professionals. In a statement in 1986, Rice and Gable said that the highest risk group that would incur the highest costs of health care are the elderly, and that statement stands true to this day. The health care, long-term care facilities, and health care insurance costs are all increasing. Those that have supplemental health care insurance and better pension plans will be able to pay for all these extra costs, but those that don't will have to suffer and pay out of pocket. Even though there's been improvements to Medicare and Medicaid in the past decade or so, the cost of prescriptions is still a concern for many. As many seniors rely on Medicare as their sole source of health care, the system needs to cover aging better. There should not be a need to have supplemental insurance just to cover basic medical care. Prescription drugs should not have high costs, and copays should be minimal, if at all. There are more community services that need to be utilized that would be helpful to get seniors the care they need. A huge portion of this is communication on the part of the patient or the elderly and their physician. That also will help protect the seniors and their medical care, having that communication between resources, medication, and cost. Back in 1991, Dr. Beers published a list of potentially inappropriate medications. Some of the medications that were on that list in 1991 that are on today's list are now considered a do not use. This publication has been updated several times, and it has a new name called the Effectiveness Data and Information Set. The National Committee for Quality Assurance now controls the updates as they come in, and every few years they do an update. As we know, our metabolism slows down as we age. We cannot eat the same foods or the amount of foods as we did when we were younger. Well, medication works the same way with our metabolic rates. So it's important to remember that when getting prescription medications as we age, it's very different than when we were younger, and especially if we're on many different medications. If a caregiver is in the position of responsibility to making sure an elderly person is getting the right medication at the right time or the right combination, they're the ones that are going to have to be very diligent in making sure they're recording the changes, or if a medication is not working, or if certain medications just don't seem to be working well together. So the caregiver and the physician have to make sure, both have to make sure that these medications are doing what they're supposed to be doing. If not, then it could potentially put the elderly person's life in danger, as well as have them incur unnecessary additional medical costs and unnecessary procedures. To alleviate some of that, there is a new electronic medical record that when a physician is prescribing medications, they can have at their fingertips all the medications and what's been prescribed. Community involvement is more than just taking care of each other and or your neighbor. There's programs that are out there that are called community-based organizations, or CBOs. These CBOs can assist in finding the right resources for the right elderly person. They can also provide culturally specific services for the older patients. To get the seniors more engaged in the CBOs and aware of CBOs and all these other resources, the information needs to get out there to not only the senior, but to senior centers and to physicians' offices and to the physicians. Another way to make sure that health care is being protected for the elderly is political activism. Even though the elderly are still voting, which is good, they need to become a little bit more involved in their community or their active groups like AARP or AMAC or 60 Plus. Those organizations are their voice to Washington to make sure that Medicare and Medicaid programs don't go away. So in conclusion, to better care for our elderly, we need to take into consideration more than just their diet, exercise, and social involvement. The community has to be involved in, and the senior citizen have to be involved in their health care and protecting their health care, medications, and community resources. There's many ways and means to get involved, and to get involved through civics, church, and education are great ways.